All right, welcome to the legs as we are wrapping up the rest of the veins on our blood vessel list. So just like with the arterial flow, we have our common iliac arteries are the ones that would merge to make the vena cava. And then they are merged, I don't want to say branched because we're not making blood go away, but we have our external iliac and our internal iliac veins. So they're very similar to the external being the larger of the two sets of these iliac veins, just like what we saw in the arterial side. Then we have our femoral, goes down to about the back of the knee. So it runs down the back of the leg. So we can see that here on both sides. So this is draining. Remember, veins are always going to be going back up this way. So we have the femoral draining into the external iliac, which will be draining into the common iliac. Okay. We also have draining into kind of this top part of the femoral with this big, long, skinny vein here called the great saphenous. Okay, so we can see that on both sides. It runs all the way down the inner medial surface of the leg. So that's the great saphenous. And then as that femoral vein kind of begins or initiates here right behind the knee, we have some smaller branches that are going to be feeding into that. So this is our posterior view. So we have a small saphenous vein coming in here. We have our posterior tibial, or sorry, popliteal, if we're going to go kind of down this way. We have our posterior tibial coming in here. We have our fibular on the side of the fibula. And just like we had our split of the anterior and posterior tibial arteries, we have our anterior tibial here that's going to be running along your tibia and then kind of scooching around the back to blend in here with our small saphenous and our popliteal, and all of those are going to drain into the femoral, which will drain into the common iliac. And then our great saphenous all brings that up here. So that's it, not too many there on the leg to wrap it up. Okie dokie. So that is your blood vessel list. We've covered it all. Bye.